I'm just going to talk through what you should expect when you come for your annual review if you're a patient living with type 2 diabetes. We would start by asking how you are, finding out if you have any current illnesses or issues to address. And then for a check, we would start by doing your blood pressure. And this is a measurement of how your heart is pumping blood around your body. So there are two levels. There's the top level that we call the systolic pressure and the bottom level that we call the diastolic pressure. And for diabetes, following certain studies, we know that you need to have a reading less than 140 at the top and less than 80 at the bottom, because that would mean it would reduce your risk to developing complications of diabetes. These complications can cause a stroke, a heart attack, affect your kidneys and your sensation in your feet. The other marker is your weight, because with type 2 diabetes, weight has a significant effect on management of diabetes. So patients who are able to lose weight by altering their diet and lifestyle, increasing exercise, actually improve their diabetes management or control. A marker of this management is called the HbA1c. This reflects the average blood glucose level for the last 90 days. It's not the same as your finger prick tests, which tells you at a point in time what your blood glucose or sugar level is. It's a good marker, the HbA1c, because it tells us what your whole body is experiencing, because this is a pigment that goes around your brain, your heart, everywhere. And the level which gives us a good indication of good control should be under 58. If you can stay between 48 to 58 millimoles per mole, it will reduce your risk to complications. We're also working at helping patients to go into what we call diabetes remission, and that's if this level can be below a marker of 48 millimoles per mole. The other levels that we check are cholesterol, because cholesterol affects your arteries, it causes thickening of the arteries and affects blood flow to these important organs that I've mentioned that you can get a complication from diabetes. For patients living with type 2 diabetes, we would like a marker for cholesterol, total cholesterol, to be less than 4 millimoles per mole. Another important measurement would be your weight. We weigh you for your check and advise you as to whether it will help you to lose some weight. There's a measurement called the body mass index, which helps us to compare different people at different heights. And we recognize that in the Black African, a healthy BMI would be between 23 and 27. And your clinic that you attend should hopefully let you know what that marker is. And the aim is for you to try and get into that range, because it'll help you to either achieve diabetes remission or get good diabetes control. We also do a foot check where we're looking for changes in sensation in your feet. Now, some of you may realize that you already have some symptoms like numbness or pins and needles, but we use a particular test to see if you have got diabetes affecting your nerves in your feet. And this tends to happen as a loss of sensation, and it creeps up the feet. So each year we do a check and we classify you as having low risk to diabetes foot disease, medium risk, or high risk. If you're high risk, you're referred to a podiatry team and they will follow you up on an annual basis or on a regular basis, depending on the problems you present with. If you're low risk, you will remain with the practice. And with moderate risk, that's someone who we'd worry about could move into the high risk zone. So the concerns there is that if you already have numbness in your feet or a loss of sensation, pins and needles, and you have a cut or an injury, you might not be aware and it could develop into ulcers in your feet. So it's really important that we identify people who are at risk from foot disease, and then again we help you to achieve good control. And as I mentioned, the good control is having that marker of HbA1c between 48 and 58. The other important check we remind you about is diabetic retinal screening. This is where you get a picture, a photograph of the back of your eye, and it's organised by a national screening programme, and they'll communicate to you often by letter, but they can contact you by text. This is done every 15 months, and during your annual check will remind you to attend. It's really important because you can get a change at the back of your eye that you have no symptom or sign, and they can identify you and refer you to an ophthalmologist who can treat you and prevent you getting diabetic eye disease, which can be quite severe and lead to loss of vision. Then again, good control with the HbA1c will prevent the chance of this happening. And then we would do what we call a care plan. So we've put all these measurements in and we've worked out what we think your issues are. So if it is you haven't attended for diabetic retinal screening, we'll remind you to chase that up. If we find you have evidence of foot disease, we need to refer you on. It may be your HbA1c is higher than it should be, and we need to talk to you about lifestyle modification, often with type 2 is important, or we need to look at your medications and see how we can improve your diabetic control. And the whole aim of this check, which is annual, is to identify people who are at risk of developing complications of diabetes. As I mentioned, the main complications are that you could end up with a stroke, which can happen suddenly, where you have a weakness in your body and a loss of function. You could end up with a heart attack, which could weaken you and, give you a disability, which might affect you working or doing other things. You could end up with kidney disease, as well as I'd mentioned, foot disease. We also do a check of your urine where we're looking for protein, which is a substance in the urine, which can be a sign of diabetic kidney disease. And so we put all of this together and then work out what's the best management to improve your diabetic control and prevent you having complications. General practice is really pushing to not only diagnose diabetes very early, but help people with diabetes to get good control so we can prevent complications, and if possible, put patients into diabetes remission. So it's really important to get this message across, especially as we know that lifestyle changes of diet and regular exercise, losing weight, healthy eating, all help us achieve this. And because it's a lifestyle change, sometimes in the short time we have in the surgery with our patients, we're not able to push this message. So I think it's really important to share this message with as many people as possible that are living with diabetes. And I always say to my patients that it's not just the patients who are diagnosed with diabetes who need to eat healthy and exercise. It's all of us to achieve this healthy lifestyle. If we all do that, we'll all prevent diabetes, because it's the fastest growing chronic disease in the world, but also will support people living with diabetes so that they don't feel that they're different in some way, but it's an important lifestyle change. So general practice at the moment is pushing, and in lots of areas in London, we have courses where you can get education. Some of them have different languages, are offered in different languages, but some of them also offer you online education and face-to-face education. So we talk about structured education, we talk about diabetes rewind, we talk about group education. I'd really encourage you to participate. You can participate with family members as well with the online courses, all of it to keep motivating, educating you and enabling you to achieve, a healthy lifestyle.